Hi, I'm Dr. Mike Milligan. We're here at the Hinman Dental meeting, so there might be a little bit of background noise. I'm with Dr. Tom Neighbors of Brentwood, Tennessee, and we're going to talk about the predisposition or potential for oral cancer and the test that they have for that. Tom, thanks so much for being with us.
Thank you, Dr. Milligan. It is a pleasure to be here with you today.
Great. All right. Well, Tom, tell us a little bit about this oral cancer risk.
Well, I appreciate the opportunity to do that. OralDNA Labs is the first U.S.-based laboratory for the dental profession. And our mission in life is to provide for the dental clinician, dental hygienists, general dentists, periodontists, maxillofacial surgeons, anyone associated in our field, molecular information that we've never had access to before.
Right.
The test that you're making reference here today is around HPV-related oropharyngeal cancers. We now know, along with alcohol and tobacco, the traditional risk factors and the abuse of those two specifics, that individuals are at increased risk for oral cancer.
Right.
In the recent years, we've learned that the human papilloma virus, which is primarily responsible for cancers in the cervical region, are also now becoming very, very widely found in certain segments of the American population. And thus we have three risk factors now known for risk for oral and oropharyngeal cancer: tobacco, alcohol, and the human papilloma virus, in particular certain high oncogenic strains of the HPV virus.
Okay, wonderful. So, and then this test tells us exactly what? Absolutely.
Through a 30-second saliva rinse, we
That's
can... Yes, it's easy, and it's quick. Through polymerase chain reaction technology, we can assay to determine if the human papilloma virus is sufficient enough to be detected in that person's saliva. If it is, then we can genotype that to determine whether it's high risk, whether it's low risk, or whether it's unknown risk. We now know that there are approximately 120 different genotypes of the HPV virus. We all have these viruses, and some of them cause warts, and some of them have the potential to cause cellular changes that we call cancer. And thus high-risk HPV-related infections give us information that we can share with the information to discuss risk. And so this can be a true screening test, and more particularly for oropharyngeal type cancers. These cancers tend to be a subset of cancers that occur mostly at the base of the tongue, the tonsillar pillars, and in the pharyngeal areas. We can see as dentists some of those areas quite well, but these individuals that are tested positive gives us an opportunity to send them to their ENT specialist with the report and have a laryngoscope done to see if there's a lesion that we can't see, and thus we can let's say, further manage and more properly manage those individuals who have these infections.
So if someone comes out high risk, it'd be a good idea to have an ENT.
Absolutely, absolutely would.
Okay. Now, how often do you recommend someone have this test?
Well, we look at risk factors, and so we know that there are a number of risk factors that are associated with oral cancer. We look at traditional risk factors, and then we also look at individuals that have other predisposing factors. We know that individuals who share risky sexual practices are at increased risk. We are entering into a world where dentistry is now becoming a part of health care.
Oh, absolutely.
And therefore, we have to be in the forefront of sharing information with our patients that we may be a little uncomfortable with, but we have to learn how to share that information, because literally it's possible that patients' lives may be at stake.
Absolutely, absolutely, yes. And we can learn more about this where?
Again, you can learn about this at our website at OralDNA.com, or you can go to OralDNAtraining.com.
Okay, Tom, thanks so much.
Thank you.
All righty.
Appreciate it, Mike.
Great.